You were prepping like a number 2 or something, and you nicked the buccal fat pad.
Oh,
and
that's gonna scare people.
No, I mean, come on, it's great. I think it's. He taught a cosmetics course.
Okay. Gotcha.
And then he became what's called my team leader.
Okay.
So we were team 007.
Okay.
He's a huge Bond fanatic.
Yep.
And so we all had team 007 pins made because he was my team leader for the last 2 years of
Licensed
clinicals.
to drill.
Licensed to drill.
Our whole thought process of how we do dentistry has changed because in the past we would take impressions of things and then cast things up in metals and gold and other things and try them in and have all these other fittings. And nowadays we can design things on the computer. With people that don't get regular dental care are more prone to cardiovascular disease and all other types of diseases because they have inflammation in their body. So just the simple...
Welcome to Minty Fresh Takes presented by Enamel, the podcast where we explore the latest trends, science, and personal stories behind oral wellness. I'm your host, Xander, and today we have a jam-packed show covering some of the most important topics in oral care. From celebrities to experts in the field, you're sure to hear dentistry content done in a fun way. So sit back, grab your popcorn and your floss because you'll need it after, and enjoy this conversation. Thanks for listening. Today we have Dr. Tom Dork with us in studio. Dr. Dork comes from Manhattan, learning about his love of dentistry at a young age of 5. Instead of pursuing his potential comic career with a friendship of Stan Lee, he decided, like his father, to become a dentist. After his undergrad at the University of South Carolina, he transitioned to studying dentistry at Fairleigh Dickinson in New Jersey. After that, he joined his father's clinic in Manhattan and quickly realized he wanted more studying, so he headed back to Fairleigh Dickinson to specialize in prosthodontics. Upon completion of this, he created his practice in Jupiter, Florida, called Aesthetic Dental of Jupiter. With unbelievable success over 20 plus years serving some of the world's biggest stars, he transitioned to teaching at Nova Dental School in Fort Lauderdale, where he met Dr. Jordan Harper, which is where we pick up today.
Well, what are some of the things, give us one aspect of dentistry that you absolutely love being able to impact families and individuals through that?
Well, a big part of my practice was doing cosmetic dentistry, and I took care of regular people as well as models and actors. And as we were talking about off camera, the biggest thrill that I had in dentistry was being able to change self-images for people. I mean, when you're able to take somebody who's really concerned with how they look and is very self-conscious, and you're able to make them into a different person, you can see their eyes light up. It's thrilling to be able to do that type of service for somebody where it just changes lives. So,
Dr. Harper, same question for you.
Yeah, for me, it's I would say some aspect of that is obviously there. He did more of it than I get a chance to do, but for me, it's like my practice is like my little flock, and I like taking care of the flock and catching up with them every 6 months and seeing how their Europe trip went.
That's right.
And I love working with my hands, so I get to meld those worlds of taking care of people and work with my hands from the surgical aspect. It's fun.
Yeah. Now, when you guys met, you guys were both at Nova Dental School. You were teaching, obviously, in Fort Lauderdale. You were teaching, and obviously you were a student. What class did we meet? What was the first class? Do you remember the exact?
Yeah, so he taught a cosmetics course.
Okay.
And then he became what's called my team leader.
Okay.
So we were team 007. He's a huge Bond fanatic.
Yep.
And so we all had team 007 pins made because he was my team leader for the last 2 years of
licensed
clinicals.
to drill.
Licensed to drill. And yeah, that's we had very common interests. We were into the same kind of genres of movies and shows.
That's right.
And I think the first time we really bonded was he found out that I also had a toy collection of Transformers.
Okay.
And he had a toy collection of Transformers and other action figurines and stuff like that. And so I was like, oh, so we're both nerds. This is great.
We definitely nerded out. So Jordan would come up to me with a project or something like that, and he would first hit me with some sort of Star Wars story or something like that, and I'd be like, okay, we're nerds. We can bond over that. And all of a sudden we developed a friendship, both personally and professionally. So.
Well, that's fantastic. And we know, obviously, that, well, actually the listeners might not know this, that there were some extracurricular movies that came about, obviously, this friendship that you guys might get a chance to see here coming up in the near future, or at least some cutaways from it, right? So, but in dental school, obviously you taught, how long did you teach it?
5 years.
5 years. Over and throughout the course of seeing new students be able to come in, what was it about Jordan that, obviously, aside from the from the similar interest outside, what was it about Jordan that you found that you're like, okay, this guy's going to be a fantastic dentist?
Well, you could just tell from his personality, how outgoing he is and how fun he is to be around, that he was going to be somebody special. I mean, he had fantastic hands, and he was the type of student that you really didn't have to explain something to more than once. Catches on pretty quickly.
Go ahead.
I was just gonna say I try.
Yeah.
And the other part I like about him is that he's so humble. So
that's right. Now let me ask you this: being in the dentistry field for over the last 20 years at minimum, what are some things that you're seeing currently to today that was still practiced 20, 30 years ago that's still a fantastic process for being able to aid people in still continuing to improve their oral care?
What a great question. Well, before we were talking about what's new, but what's old, I mean, basically we're still doing the same thing. The concept in dentistry is that you're trying to take care of the whole person. And when we're taking care of people in dentistry, we've discovered scientifically that oral health is connected to whole body health.
Yeah.
So just the very fact that you go in to get a simple cleaning with us, you're not only taking care of your mouth, but you're also taking care of the entire system of your body.
Yeah.
So people that don't get regular dental care are more prone to cardiovascular disease and all other types of diseases because they have inflammation in their body.
Yeah.
So just the simple aspect of doing a cleaning lowers the amount of inflammation in your body, and it's a huge thing for your health that people don't even take into consideration. So even some of the simple things we do in dentistry have profound effects on people.
Yeah. Dr. Harper, same question for you as well.
I've only been a dentist for 10 years, so I can't speak to the decades old type thing, but the concept of how we're trying to save the teeth, the advent in the last 100 years of not just cosmetic dentistry, but our, prosthodontic work from a fixed standpoint with implants and crowns and bridges and those types of things. The whole goal is get you to the grave with all your teeth.
Yeah.
Right? Or at least as many teeth as you possibly can. And that concept hasn't changed. The technology has obviously, even since I've just been out of school, has drastically improved.
Yeah.
Paradigm shifts in materials and technology that allows us to do our dentistry better, more precise, and faster, which is great for patients and us too.
And that's one thing that we were talking about off camera was the improvements that you've seen from when you got started early on to where dentistry is today. Could you kind of walk us through the benefits of some of the things that we're seeing now?
Well, in the olden days, when I was younger as a dentist, we didn't have implants. So the fact that we have implants that work and work successfully in high 90 percentile is incredible because there's very few medical procedures that work that well.
Yeah.
So we're able to replace teeth that we weren't able to do before. So when I was first trained, we tried to save every little thing that we could in the patient's mouth. And that philosophy has changed to where if you feel like you can't successfully replace something in a high 90th percentile, then you go to implants, which is a huge change in, paradigm shift. So, I mean, I don't think Jordan was even exposed to what I was trained in perioprosthetics, where every little root, every little piece of tooth was tried to be saved. And with crowns, we would rehabilitate the mouth. That type of theory has kind of gone out the window. And now that we have implants, we kind of jump into that. One of the things that we talked about before is that even our whole thought process of how we do dentistry has changed, because in the past we would take impressions of things and then cast things up in metals and gold and other things and try them in and have all these other fittings. And nowadays we can design things on the computer with CAD/CAM. And even have things, it's kind of, like I said to you before, it's kind of like time travel. We can have things done before you even have the patient there. So it's really interesting and very exciting to have, at least in my lifetime, to have been able to see 3 different ways of doing dentistry. And, it's fun even just to see what's going to happen next is very exciting.
Yeah. And Dr. Harper, same question for you. I know that you had said even over the last decade of you coming out from where we are to today.
Yeah, I think, just the big advance we've had in the last 10 years since I've been out is the digital technology. When I was in dental school at Nova, we were fortunate to have the very expensive CAD/CAM capture systems and digital impression and mills and all that stuff. And And
And I helped teach that.
yeah, it did. It did. And back
Not
then,
bad for an old guy.
back then we still had like you still had to spray like a powder on the tooth when you did a crown prep to capture it in the camera. But now the cameras are so good and so much smaller and so much faster, so much more accurate.
Yeah.
None of that's even needed. Just dry the tooth and go real quick, and it takes 3,000 pictures in a minute and a half, and you're done.
Oh, yeah.
It's fascinating, and it's precise down to the hundredths of a millimeter. It's amazing precision, and so that aspect I think is what really transforms the patient experience, makes it easier on them, easier on us, makes everybody happier. Everyone's already miserable to go to the dentist. We know that. So we're just trying to, as dentists, make this process a little easier for you, so that you may like us and not hate us.
Now, let me ask you this. So after your 4 years at Fairleigh Dickinson in New Jersey, you went back and you worked with your dad for a year, and you quickly realized, you said, I need some more school. Right. And so you went back to Fairleigh Dickinson and you specialized. I don't know if majored is the correct term, but I would say you specialized. Right. You specialized in prosthodontics. Correct. For the average person that's watching it, could you kind of go into a little bit of detail about what prosthodontics is?
Prosthodontics is a field in dentistry where we do more sophisticated dentistry than the average general dentist would do. So we have more background in taking care of people's bites, taking care of large cases where you might do every single tooth in a person's head.
Yeah.
A small percentage of it is taking care of people after they've had cancer treatment and might have lost part of the bony structure of their face, and we're able to try to replace that and try to help them eat better and function better and speak better. It's just, I liken it to like a super dentist where we just have a little bit more training than the average dentist has.
Wow. Okay. You had said there's only 5,000?
I think there's 5,000 to 8,000 of us in the country. So, I mean, a lot of people when you're at a party and they ask you what you do, they think you do root canals or they think you do gum surgery or whatever. And I don't correct them. So
Gotcha.
it's just too much time. It's too much time.
Too much time to explain.
That's right. So quick question for you. Obviously, with you studying for as long as you have and practicing for as long as you have, do you have any stories that would make the average person listening to this go, wow, that's incredible? Or maybe even laugh?
I have a great one. I want to hear. You told me.
No, you go first.
So he told me about, I think it was your first week out of dental school. And it was like you were prepping like a number 2 or something, and you nicked the buccal fat pad.
Oh,
and you
scare people.
No, I mean, come on, it's great. I think it's, I mean, it all worked out. It's all fine. It was like, oh, what was this? I think it was good.
So there is no dentist that likes to work on tooth number 2. And what that is it's an upper molar in the back.
Okay.
And it's on the side that's closest to them. So it's really hard to see. And you're retracting the cheek and it's indirect vision because you can't turn and look at the tooth like this. It's really hard to do that. And there are some people that have really fat cheeks and really curious tongues that go up there while you're using the drill.
That's right.
So you're having to protect the cheek, you're having to protect their tongue, and they're breathing heavily into your mirror and they're salivating. And it's really hard to do. It doesn't matter how much experience you have. It's incredibly hard to do. So
how often, not to cut you off, but how often would you see this?
It's really funny. Sometimes you don't see it very often, and then all of a sudden that's all you're doing for weeks at a time.
Yes.
So like, how does that happen? I don't have my
question. Why did I do this?
Two. So a lot of dentists go, oh, we'll just watch that. I'm not working on that. Okay. So at any rate, and actually this was further on in my career. It was actually working on somebody where I was doing a huge case, and they were a person that was kind of intimidating to work on. But at any rate, they were like, I'm not allowed to say what they were. But anyway, so I'm working on this, and all of a sudden, looks like a bunch of yellow pillows fall down into the patient's mouth. And I look at the assistant, who's actually, I had been in practice already for, 20 plus years. And the assistant that I was working with was even more experienced than me. So I look at her, and there's this. So I do what I normally do. I tell the patient, let's take a break. I have to go take a look at a hygiene patient, and I run to my phone and I call up my oral surgeon and I describe what happened. And he goes, oh, that's the buccal fat pad. You've nicked part of the cheek, a little hole was created, and a piece of fat fell into the mouth. And I'm like, okay, what am I supposed to do? So he's like, okay, irrigate out from where it came from. So we used Paradex to clear it out, and put it back in and sutured it up and continue to work. But that's, that was a first for me.
Oh my gosh, I bet that scared you to death.
It did. It took me a while to recover. Yes.
Oh my goodness.
But then I had to continue working on the rest of the patient's mouth, because this was not just number 2. I was doing their entire mouth at that time. So.
Wow. And just for everybody listening, Dr. Dork has worked on some very high profile clients, not only from his dad being in Manhattan and working amongst all of the high profile movie stars, but obviously as he brought his practice down to Jupiter, that did not change. So that also was the case for him as well. So that is an incredible story. And I find that, for somebody like yourself that, like you said, that does it every day, I'm sure it's not very often that you go, oh my gosh, what is that? Oh my goodness, that is incredible. Dr. Harper, do you have any stories?
I mean, yeah. So I have probably 2 that people would find interesting. One is similar to his. Like, we were working on the lower arch, and the patient decided to swallow, and as they swallowed, their tongue slipped past my mirror while my handpiece was at 400,000 RPMs, and I lacerated the floor of the mouth, and you could see everything on the floor of the mouth: muscle attachments, salivary glands, the whole deal. And so I had to end up placing, the patient, fortunately was numb, so didn't feel anything when this transpired, but knew something not good just transpired. And I said, yeah, you just swallowed into my handpiece. Really sorry about that. It happens when you swallow and your tongue gets past my mirror. So I had to suture them up, and they were fine. A little uncomfortable for a week, but they were fine.
Just to let you know, that happens often.
It does happen often.
And a lot of times you can't suture up the mouth, and it just has to fill back in.
It just has to fill back in.
Yeah. Fortunately, it's not an error. I mean, it's uncomfortable, but fortunately for the patient, it's not going to cause it looks horrible. Yeah. You change your underwear after you do that.
Yeah.
You definitely take the lunch break early.
Yeah, and I can't reiterate what he said enough. It's like I'm so happy and glad that I'm a dentist, but no one can prepare you for how difficult it is. Yeah. And there's I feel like a lack in the general public of the appreciation of just how difficult this is. Yeah. Most smart surgeons, they went to school and they put their patient to sleep when they operate on them. And then here we are as dentists, the idiots of the crew. We're like, no, let's do it all awake. That sounds like a great idea. And it's difficult, man. It's your mirror's fogging. You're trying to do something with indirect vision. There is no room. There's saliva everywhere, and we're doing something where we need it dry. And it's chaos. And we're trying to do this every single day on every single tooth. And it's a very difficult profession.
Let me ask you this: for future dentists coming up, just to give them a little bit of hope, obviously for 2 successful guys that have been in the field for a long time, when did you guys start feeling comfortable as a dentist? Like, at what point did you go, okay, I'm pretty good at this? Maybe it was early on in school, but at some point, like you were talking about how
I'll go first. I was blessed to have him as a team leader. Yeah. I did more units of crown and bridge than anyone in my class of 130. And that's largely because of him, because I was able to get tons of great experience. So I had tons of confidence coming out of school that my classmates maybe didn't have. Still, it takes you a lot of people will know what they're doing. Some people need to go to GPRs for an extra year to really understand, get a better grasping feel. Yeah. I came out of school knowing exactly what I wanted to do. I didn't want to do root canals. I didn't want to place implants. I didn't want to do orthodontics. I didn't do everything. I just wanted to do bread and butter dentistry and focus on restoring implants, large cases. He taught me a lot. So I felt like I had a lot of confidence in large cases. And so for me, though, I would say about that 2nd or 3rd year mark, he really hit a stride. Yeah. And then it's probably I think every year that ticks by, you get faster and more proficient at what you do. Yeah. And it's by year 7, 8, you've hit max speed, I feel like, that you can get, to do something well and not, hack somebody up, but to do it well, get it done fast. Yeah. I think at 7, 8th year mark, you're really hitting your prime and stride. And also, too, you've had 7, 8 years of doing continuing education, right? So you've had 7 and 8 more years of continuing to learn and advance your skills and get better. And you've seen more things, right? Practice makes perfect. There's a reason they call it practice, right? Medicine is practice because we, as the providers, you can only learn so much from a textbook. A lot of it is all about experience, right? And at that 7 year mark, you've seen a lot of interesting, unique, weird things. You've seen teeth behave in ways that textbooks don't help you learn how to do. So you really are equipped to be understand the biology and the common sense that comes behind a lot of teeth and how they behave. And then sometimes teeth just don't behave with common sense. It's just annoying, you know, and the patient wants an answer, and it's okay to say, I don't know.
Yeah.
And you learn that quickly.
Yeah. And you have to have the confidence to be able to say, I don't know.
Yeah, absolutely. Yeah, absolutely.
Yeah, because when you're younger, you want to be able to have the answer for everything.
For sure.
And you don't have the answer for everything.
When did you feel like you hit a stride as a prosthetist? Because you had a lot more going on.
It's interesting. I agree with what you're saying. I think over time, how I look at my career is like every 5 years, you're amazed at how much better that you've gotten. Like at year 5, you think, oh, wow, I'm pretty good. And then all of a sudden, year 10, you went, wow, I really thought I was good at year 5.
Yeah, that's right.
How much better you get. And then you get better and better and better as time goes on. And what he was saying is really important. I think at the beginning, you know, the dental schools try to give you the clinical skills, but you develop that judgment from experience as time goes on. That's so valuable that you don't have at the beginning. And the other thing that isn't talked about very much is you kind of like suffer from this imposter syndrome where you think you're never good enough.
That's right.
So like if you're really the type of person that's a type A personality where you want everything to be perfect, and if you're talking about with a young dentist, you know, you have to avoid that.
Yeah.
You know, that's a stressful thing. Everything doesn't have to be absolutely perfect. Everything has to be very good, excellent, but perfection is very hard to get to in anything. In fact, you can never get to perfection.
Yeah.
So for a younger person, that's what I would say to them is try to avoid that trap.
Yeah.
And just try to get to be a better version of yourself every year. Go for continuing education like he does.
Yeah.
Continue to work on your skills. Seek out older practitioners that you know that are really good at what they do.
Yeah, that's right.
Pick their brains. And it's an ongoing thing where it's an evolution where you get better and better over time. And it's much more fun, just like in life, to try to improve yourself. Don't compare yourself to everybody else.
That's right.
It's just for yourself and get better and better and better. And there's also, I considered myself the 7%. And the 7% is the type of people that want to get better and better, want to get continuing education. And then when they do have a certain level of skill, they want to give that skill and mentor other people. And it's important to be able to give back to your professional like that.
And I think too, as a young dentist, it's important to have a mentor to look up to. Because I distinctly remember a couple of times I would have a patient in the chair and I'm texting him x-rays and internal images. And I'm like, hey, look, do you think this tooth's salvageable? And he would, call me and go, listen, in my day, everything was salvageable. So yes, just make sure you do X, Y, and Z and it'll make it happen. And it was great. It's a great learning experience, because at the end of the day, our goal is to save as many teeth as possible. And it helps having that perspective of because as a new dentist, you don't know, okay, well, the ferrule is so small and we only have this much tooth structure left. Is this going to realistically last for 5 or 10 years? And that's our goal, right? We don't want to take people's money and have something break in a year or two. That's not cool. And so we want people to get their bang for the buck, right? And you don't really know that until you get out and see what works and what doesn't work in your hands.
We really didn't get too much into the fluoride versus microhydroxyapatite conversation. And I really would love to get your kind of high points on the impact that you see in the difference of route between fluoride and the microhydroxyapatite. And then obviously with Enamel and what we're building here with the brand new product, maybe touch on a microhydroxyapatite, what you're seeing and the benefits of using that in your toothpaste.
I think the major benefit right now is that today everybody's concerned about fluoride.
Yeah.
So, if you're worried about what you're going to be putting into your mouth and in your system, I think by using the microhydroxyapatite, I think that you're putting in a very inert substance in your body that's super helpful for you. And I think that's the major advantage of your product. Wouldn't you agree with that?
No, 100% agree. Yeah, I think it's just I think after when COVID hit, people started thinking about what they put in their bodies more. That's at least what I perceive with my patients. People genuinely before maybe people wouldn't grab that food or grab that medicine or grab whatever the toothpaste and look at the ingredient list ever. I was guilty of that too. And then now, it's happening with different, oils, the vegetable oils and that type of stuff. And fluoride's just kind of the latest victim of that that result.
How does biscuits and gravy fall into that?
Ooh, I can't give up a biscuit. I'm from the South, man. It's just the best, It's just the best.
So what we're saying is everything in moderation. I think.
That's right. Yes.
And I think that's the biggest thing that I've learned, obviously, through the podcast with you guys, is, knowing that, like you're talking about, everything in moderation. There is no one right way to do something. We recommend 2 minutes every single time you brush. You recommend, flossing once a day, using the toothpaste tabs, using micro-hydroxyapatite, but there's not this one right way and only way to do things specifically in dentistry. But it's just making sure, obviously, that I come back as a patient every 6 months to come see you guys and making sure that obviously I'm maintaining my mouth and doing what I need to. And obviously with the micro-hydroxyapatite, it seems like that is a superior product that's now entering the market that will be better to help me maintain down the road.
Yeah, because ultimately the oral health, we only see you twice, we only see you twice a year, right? For most people, it's only twice a year. Some get 4, but for the most part, we're seeing you twice a year. So the buck stops with you. Right? Mm-hmm. It's up to the patient to take care of their own oral health at home.
That's right.
That's the important thing.
That's right. Well, Dr. Dork, thank you so much for being on the show. We really
Thanks for having me. Yeah.
Yes, thanks for coming. It's been fun.
I know I think I can speak for both me and Dr. Harper. We would love to get you back on another show.
Anytime. That's great.
And then really get into the nuts and bolts of dentistry and maybe some more stories. So
sounds good.
That sounds great. Thank you so much. We appreciate it. We look forward to the next show.
Thanks again.
Awesome.
Hey guys, thanks so much for tuning in to another episode of Minty Fresh Takes, presented by Enamel. Listen, we all know people that are into the latest trends for their oral care. We also know people on the other side of the spectrum that are not. This show is made for both of those people. And so if you could do us the absolute biggest favor and share this, like, comment, subscribe, but make sure to share this with your friends on both sides of the spectrum and somebody right in the middle, that would be awesome. Our biggest mission here, not only doing this podcast, but with all the products and the dentistry here in Niceville, is to ensure the trust and the quality of product that we continually offer to our patients. Our mission through this show and through our brand new product Enamel is to ensure that your teeth are being covered by nutrients that actually benefit your teeth, i.e. micro-hydroxyapatite. Our toothpaste tablets that we have right here, toothpaste tablets and the luxury mouthwash tablets, these are both available at enamel.com. That is ENML.com. And if you're looking for more information on micro-hydroxyapatite, feel free to check out our latest YouTube videos. Like we said earlier, make sure to subscribe to this channel. You don't want to miss anything that we have coming out. And thanks so much for watching. We'll see you on the next show.